Thank you for joining today's webinar for the Patient Safety Prize. My name is Susanna, and I work for CARET, the agency that's supporting the Elevance Health Foundation for this challenge. This webinar is being recorded today and will be available on the news and updates page of the challenge website by early next week. We will also email it to those who have registered for the challenge. We've reserved most of our time over the next hour for your questions. In just a moment, Dr. Shantanu Agrawal, the Chief Health Officer of Elevance Health, will welcome you and provide an overview of the challenge. I'll then do a quick walkthrough of the challenge website with my CARET colleague, Ethan Matthews. Then, my colleagues Amy Klein, Cristobal Villena, and Amare Silva, also from CARET, will help open it up for your questions. As questions come up, please type them into the questions box and we'll answer as many as we can during our allotted time. If you have a question that does not get answered during this call, we encourage you to email questions@patientsafetyprize.org, and we'll make sure to follow up with you directly. Before we move on, here are some very important dates to keep in mind. The deadline to register for the Patient Safety Prize is in a little over 2 weeks on Tuesday, March 17th, 2026 at 5 p.m. Eastern Time. Please note that you must register to submit an application. We're also planning a pre-application webinar on Tuesday, March 24th at 1 p.m. Eastern Time. The sign-up link for that session will be shared with all registered applicants shortly after the registration deadline. If you have questions after today's session, you can always reach us at questions@patientsafetyprize.org. And now, I'm pleased to turn things over to Dr. Shantanu Agrawal, the Chief Health Officer of Elevance Health.
Yeah, thank you very much. I'm Shantanu Agrawal. I'm an emergency medicine physician and the Chief Health Officer for Elevance Health. I want to welcome everyone that has joined the webinar today. We hope you find it to be very informative and you're able to get your questions answered to make sure that you are assessing the possibility of entering the application for this prize. So again, we're really excited about the work. Thank you all for attending and for showing so much interest in the Patient Safety Prize. Just to provide you an overview, a little bit about what we have in mind with this prize, I think all of you on the webinar will know just how incredibly important patient safety is for Elevance Health, for our provider network, for other peer companies in our industry. But unfortunately, healthcare today falls really woefully short on patient safety. Particularly in how we approach safety and try to preserve it in our communities and actually tie to the work of our communities. Being very community focused is really central to the Elevance Health Foundation. So we want to make sure in this Patient Safety Prize that we are staying very centered on communities. If you've seen the website, and we'll certainly walk you through it, there are 3 areas that we're focusing on when it comes to the Patient Safety Prize. They are health literacy to promote safer patient care and to promote more active patient and member involvement. Second is the elimination of medication errors. And third is really promoting a fall-free future. We chose those areas of focus very specifically, working with a number of experts, both inside our company and externally. Again, I don't want to give you an exhaustive review of the data. I think so many of you will know it. The CDC reports, for example, that there are nearly 1.5 million visits to ERs every year for adverse drug events, tying, of course, to our medication safety pillar. The Agency for Healthcare Research and Quality, or AHRQ, estimates over 700,000 and perhaps up to 1 million falls every year just in U.S. hospitals. But we know that when a person, a patient, has a fall risk, they of course can experience those falls at home in their community as well, and that data is not as well counted. And the Center for Healthcare Strategies also finds that nearly 9 in 10 adults struggle with health literacy, which frankly increases the risk of preventable harm. So it's really data points like that, and frankly many others, that caused us to evaluate or look at these 3 areas of focus for the Patient Safety Prize. What we are looking for truly in this prize is innovation to meet the goal. As you will hear more about how to apply and how to apply for each of these pillars, but we want to really see innovation, collaboration, and the winning recipients, of course, will address these critical patient safety challenges. One thing I do want to highlight is that this prize is really meant to identify and promote solutions that work. This is fundamentally not about conducting research or other activities. Those activities are extremely important for patient safety. However, our approach with the prize, working with Carrot and working with a number of different partners, is to identify solutions that we know work today so that the prize can help to promote and scale and socialize those solutions. So I think that is very important as organizations and individuals think about applying for these prizes. We really I urge you personally to stay focused on solutions with a demonstrated track record. So with that, that's really what I wanted to say in introduction. Again, I'm thankful to all of our partners and to the foundation team for the great work that's being done here, and I will turn it back to them.
Thank you. Okay, so next we'll go through an overview of the website and the process to participate in this challenge. The first step to determine whether you're a good fit for this opportunity is the Participant Readiness tool, which you can access from the main drop-down menu of the website. The tool walks you through several questions to determine eligibility for this challenge. If you answer yes to each question in the Participant Readiness tool, we encourage you to complete the registration process. If you do feel that your organization is a strong fit for the Patient Safety Prize, we encourage you to complete the registration process as soon as possible if you have not done so already. The registration is required for you to be able to submit an application. Registration is very simple. You'll go to the upper right-hand corner or footer of any page on the website and click on the blue button that counts down the number of days left to register. You'll then be instructed to create and confirm your account. Once confirmed, you will be prompted to submit some basic information about you and your organization so that we can better understand our registrant community. You can opt in to receive an email confirmation of your registration, and if you're able to access the online application form and forums on the platform, then you've registered properly for the challenge. The Patient Safety Prize, like all of our challenges, is rooted in the values of openness, transparency, and fairness. We want to be sure that everyone who registers and applies for this opportunity knows exactly what we expect from them, when and how they're going to be scored, and who will be evaluating their solutions. This website is built as an instructional guide to understand that process. An important resource to review, even before you register, is the application. The full text of the application is available for any visitor to this site. You can see all of the questions, prompts, requirements, and word count limits on this page. The application has several sections. You're encouraged to read all of them so that you have a good grasp of what is required to submit a full application. And once you've done that, you should have a strong sense of what you'll need to do to apply. Now, let's take a look at the About page. The About page provides additional details about the challenge, including more information about the 3 solution categories for this challenge: empowering health literacy for safer patient care, innovating to eliminate medication errors, and promoting fault-free futures. And now, let's visit the rules page of the website. Here you can read about the legal stipulations governing your participation. You can find the eligibility criteria and learn more about the detailed terms and conditions. Administrative review will take place immediately following the submission deadline. The Patient Safety Prize team will review all submissions to ensure they comply with the rules and application requirements. All complete and valid applications will move on to peer-to-peer review. And so the next question we typically get is, how will the applications be evaluated? So on the challenge website, you can click on Scoring Process and then Scoring Rubric, to see the 4 criteria that will be used during the peer-to-peer review process, as well as by the evaluation panel to score and comment on the submissions. The 4 criteria are impactful, innovative, measurable, and sustainable. Each trait consists of a prompt that details what each of those criteria mean in this context, and each trait will be given a score between 0 and 5. You can toggle back and forth between the scoring ranges for any given trait, and a phrase will appear to provide further detail on what a low and high score means for the patient safety prize. We encourage you to familiarize yourself with this rubric to help build a strong proposal. And then this brings us to the actual scoring process. Administrative review will take place immediately following the submission deadline. The Patient Safety Prize team will review all submissions to ensure they comply with the rules and application requirements. All complete and valid applications will move on to peer-to-peer review, which is a required component of the Patient Safety Prize. Please consider this as you solidify your plans to apply. Peer review will take place over a few weeks from mid-May to early June. During this time, each lead organization will be required to review and provide scores and comments on 5 other applications using the scoring rubric. Your review will happen on the same platform you're using to submit your application. Once peer-to-peer review is complete, a selection of top scoring submissions will move into evaluation panel review. We invite you to check out this evaluation page on the website and then click Meet Our Judges to learn more about our confirmed expert reviewers at this time. More judges will be added to our website soon, so please check back in the coming weeks. The evaluation panel is comprised of individuals with various backgrounds and expertise within the 3 solution categories. Peer reviewers and the evaluation panel will use the scoring rubric to provide scores and valuable feedback on their assigned submissions, and all scores will be statistically normalized to ensure fairness. Not only will you receive scores on your submission from 5 fellow applicants and 5 of the evaluation panel judges, but you'll also get feedback. In addition to numeric scores, reviewers are required to provide comments to justify each score and note their overall impression of each application. We often find that this feedback is one of the most important aspects of participating in our challenges for applicants, and that even if you're not selected as a winner or an honorable mention, you walk away with valuable feedback that you can then use to refine your solutions and seek other funding or expanded support. And then, informed by the resulting rank order of applications after evaluation panel review, at least 5 finalists will be selected. Finalists will have the opportunity to apply the peer review and evaluation panel feedback provided on their applications to strengthen, revise, and refine their projects. Finalists will create a pitch video and share an optional project update for consideration by the selection committee. And then this brings us to another common question we receive. How do we ensure the process is fair? To address this question, we have a webpage dedicated specifically to explaining how we normalize scores. I mentioned every valid application will first be scored by 5 fellow applicants. Then each application that moves on to the evaluation panel will also be reviewed by 5 total judges. This means that not every applicant and not every judge will look at every application. We make sure you're not disadvantaged if, by chance, you are assigned to a hard grader and another applicant was reviewed by someone who tended to be a little more lenient. In brief, all scores are rescaled and normalized. If you go to the menu and click on Fairness, you can read more about how this works. And next, we have a timeline page that details each phase of the challenge. And again, as a reminder, registration is required and must be completed by 5 p.m. Eastern Time on Tuesday, March 17th, 2026, for you to be able to submit an application. Once you register, you'll have access to the full application platform where you can enter and submit your application. The submission deadline is 5 p.m. Eastern Time on Tuesday, April 7th, 2026. And then the timeline goes on to list all other key dates related to the challenge, including peer review, evaluation panel review, finalist selection, award selection, and award announcement. And then our website also includes other helpful areas like news and updates. Here we'll post the recording of this webinar and other updates along the way. And it looks like maybe we need to refresh the page. And the news and updates page is accessible via the main menu of the website and clicking news and updates. And on this page, we'll post the recording of this webinar and other updates along the way. So please be sure to continue checking that news and updates page for more updates. And then we also have a series of frequently asked questions on the FAQ page of the website. Give us just a second as we reshare so you can see that FAQ site. And as a reminder, a recording of this webinar will be made available to folks on that news and updates page I was just talking about. We will also email the recording to all registrants early next week. And it looks like
Just a moment here. We just lost our share.
sounds good. And we have received questions that were submitted via the Zoom sign-up page, so we'll address those today. Of course, as you have questions come up during this call, feel free to add them to that questions tab in the Zoom call, and we will answer those as well. If you have any questions that come up after today's webinar, feel free to email us at questions@patientsafetyprize.org. And it looks like our screen's back up and running, so if you could go to the FAQ page, that would be great. Thank you. And so the questions answered on today's webinar will also be added to this page, and we'll continue to update this page throughout the process. We encourage you to read over all of these FAQs and continue to check back this page for updated information and guidance. And now we can move on to the Q&A portion of the webinar. So please continue to add your questions to the questions box, and we'll get to as many as possible today. And again, as a reminder, if you have questions after today's session or technical requests that come up, please email us. The email address is questions@patientsafetyprize.org. And please note that to ensure fairness, we're not able to provide guidance specific to your proposed solution. And all right, we can get started. I'll let Amy and Christabel take it from here.
Thanks, Susanna. Let's start with general questions we've received about the challenge. First question, what can I win?
So the Patient Safety Prize invites pioneering community-informed solutions that have proven impact around improving patient safety under 3 categories that were discussed. They are empowering health literacy for safer patient care, innovating to eliminate medication errors, promoting fall-free futures. So Elevance Health Foundation will offer a prize pool of up to $5 million total. So up to 3 winners will each receive $1.5 million each, and up to 2 honorable mentions will each receive $250,000.
Next question, how can I ask questions or get help with accessibility?
Yes, so for any questions or requests for technical support, please do email us at questions@patientsafetyprize.org. Again, any challenge-related questions or questions for help for accessibility and special accommodations and any technical support.
How do I sign up to receive challenge correspondence like deadline reminders and application status updates?
So once you have registered on the platform and throughout the challenge, we will send important notifications to the email address that is associated with your account, as well as the primary and secondary contacts listed on your registration form. So there are 3 important steps to help make sure that these messages are received promptly. Please add questions@patientsafetyprize.org to your contacts. Please also whitelist our email address if needed. And there are instructions about how to add to your whitelist in the FAQ section labeled About the Challenge on the challenge website. And then update your registration form right away if one of your contacts change. So once you're logged into the platform, you'll click on Submissions on the top right and select Registration Form to update the information there. And if you need to make a change after the application window has closed, please email us and we will assist you.
Now let's move on to questions about eligibility. Who can participate? Are 170C1 public universities eligible to apply?
The Patient Safety Prize welcomes applications from nonprofit and for-profit entities located within the United States and U.S. territories. Each applicant must identify a lead organization who will assume responsibility for the receipt and management of any award. Public universities that are tax exempt under Section 170C1 are eligible to apply. Please review that FAQ section labeled eligibility, as well as the rules webpage for the complete information about eligibility requirements.
Next question. Am I eligible to apply for the Patient Safety Prize if I also plan to apply for other Elevance Health Foundation funding?
Yeah, so the Patient Safety Prize falls under a different funding pillar within the Elevance Health Foundation and has a separate selection process, and the grants or impact investing programs. So as a result, applicants are eligible to apply for both at the same time. Please note that the proposed projects must be separate and distinct, and there should be no overlap in team members assigned to each proposal. So while they are separate review processes, we will be informed of the details of both applications to ensure there is no overlap.
What types of projects are you looking for, and what project stages are eligible?
The Patient Safety Prize invites proposals for innovative solutions that improve patient safety through community-informed solutions in 3 areas: empowering health literacy, eliminating medication errors, and promoting fall-free futures. Again, descriptions of each of those solution areas can be found on the About page of the Challenge website. Strong proposals should emphasize positive outcomes for vulnerable populations. And eligible proposals must be able to demonstrate proof of concept, evidence of scaling, or current operations at scale. Projects in the research or ideation phase are not eligible to apply. Again, be sure to review the submission requirements on the application page for more information about the eligible stages and the scoring rubric to understand how applications will be evaluated and how we have defined a strong proposal. So for example, proposals that do not have clear goals and objectives will be unlikely to score well on the measurable trait.
The following questions will relate to the application. How do I apply?
We encourage you to first assess your fit and eligibility for the Patient Safety Prize by completing that readiness tool featured on our website. Then, register on the online platform no later than 5:00 p.m. Eastern Time on Tuesday, March 17th, 2026 to participate. Registration is required and is a simple 2-step process. So first, you'll create a username and a password. Then please check your inbox to confirm your registration. And next, complete that online registration form. And then once you're registered, you'll be able to submit your application online no later than 5:00 p.m. Eastern Time on Tuesday, April 7th, 2026.
Could I complete more than one submission?
So you may only complete one submission as the lead organization. An organization can serve as a partner on a team for multiple applications, as long as each application proposes a separate, distinct solution. So this means each project can only be submitted once, and we leave it up to each team to designate their eligible lead organization. Regional or location-specific branches of larger organizations, as well as departments, schools, nonprofits that are within or based in a college or university, those can each register and submit separately as a lead organization on an application. Participants may list both the parent organization and a specific applicant or project in the lead organization field on the registration form, such as college department, in parentheses, parent organization, or the parent organization hyphen project name. So for the situations I just mentioned, please note that the proposed projects must be separate and distinct. There should be no overlap in team members. And really the intent of this policy is to help ensure that any team is concentrating their best effort into a single application. We encourage teams to select a single project that best represents your organization's ability to deliver a solution that meets the scoring criteria. And again, review the rules for more information.
Next question. For the application, is the video required? And how do I upload my video to YouTube?
Yes, so each application must include a brief video of no more than 90 seconds that showcase your project. This does not need to be professionally produced. A video shot on a smartphone is perfectly acceptable. The quality of your video will not impact the outcome of your proposal. Please review the FAQ section labeled application for some instructions for recording and uploading your video on YouTube. And then for more information about video guidelines, review the application. And then please note you may set the privacy settings on your video to public or unlisted. Please do not set them to private. When setting is unlisted, only those with the URL, such as the patient safety prize team or the evaluation panel members and the selection committee, they'll be able to access and view the video. And if you need technical support, you can always email us at questions@patientsafetyprize.org.
Next question. How do I enter information into the detailed timeline?
Here's some general tips and guidance when working on the detailed timeline question in the application. So first, if you're having difficulty fitting your timeline steps within a maximum number of days allowed for the duration, you may need to consolidate some of your activities that overlap within that 2-year time frame, consolidating them within a single task on the table so that you can stay under the required maximum number of days on the detailed timeline table. And then you may further explain the timeline under the plan and timeline narrative question as well. We understand that combining overlapping activities may reflect an inaccurate total duration. Please let that automatically calculate as is, and we will take this under consideration as we complete review. It's more important that the start and end dates fall within the 2-year project period and that you meet the requirement of staying within that total number of days allowed for duration. And then if you prefer to type the start and end dates instead of selecting them from the calendar feature, please use the format month-day-year-year. And then some users of Safari have had issues selecting calendar dates, so please consider switching to Google Chrome if you experience trouble selecting dates in Safari. Please also be sure that you're not selecting a start date that is past an end date that you have entered prior, as the start date will be grayed out if you do. And then each description field here has a 30-word limit, so we'll leave it up to each participant to break it up and provide as much detail as they prefer. Keep in mind that sections like the timeline and budget are an opportunity to give evaluators a general idea of the plans and activities that you have in place and could be considered when evaluating for sustainability. Again, please see the scoring rubric to learn more about how we have defined a strong proposal.
Is it possible to edit the registration form once it's been submitted?
Yes, you may update the registration form up until the application deadline at 5:00 p.m. Eastern Time on Tuesday, April 7th. We'll do this from the Submissions tab on the platform. You can select Registration Form to update any information.
Are application materials confidential?
Your submission may be shared with 5 of your fellow applicants as part of peer-to-peer review, 5 evaluation panel members, selection committee, the patient safety prize team, and others at the discretion of the patient safety prize team during the evaluation process. And portions of your applications may be published online and may be shared with the general public to promote your proposal or to highlight results of the challenge. So those portions may include, but are not limited to, lead organization website, solution title, solution statement, executive summary, video pitch, and the solution description.
Okay, let's move on to questions about evaluation and selection. How will submissions be assessed?
Great question. So once the submission deadline passes, Patient Safety Prize team will perform an administrative review. This will confirm that each submission meets the rules and the submission requirements before advancing to peer-to-peer review. Peer-to-peer review is required for applicants to complete from mid-May to early June, and this is required to remain eligible for the prize. Peer-to-peer review will result in a rank order of all submissions, and then applications that advance to peer-to-peer review will be scored by 5 fellow applicants. Based on the rank order of scores, a selection of top scoring applications will move forward to the evaluation panel. And again, the peer reviewers and the evaluation panel will use the scoring rubric to provide scores and valuable feedback on their assigned submissions. And all scores will be statistically normalized to ensure fairness. Applicants that advance to the evaluation panel will be reviewed by 5 of our judges. And you can view more information about the evaluation panel judges who are confirmed at this time by clicking Meet Our Judges from the evaluation page of the challenge website. I'll show that in a moment. And from that Meet Our Judges link, you can view the titles, organizations, and bios of our expert reviewers. Then the Patient Safety Prize team will review the top scoring submissions that result from evaluation panel review, select top scoring applications for consideration by the selection committee. Finalists will have the opportunity to apply the feedback that they've received from their applications to strengthen, revise, and refine their projects. And then finalists will create a pitch video and share an optional project update for consideration by the selection committee. The selection committee will be composed of noted leaders and experts representing Elevance Health, as well as members within the fields of health and patient safety. So based on considerations that may include, but are not limited to evaluation panel resulting rank order and ensuring we award a wide range of solutions and geographies, the selection committee will recommend up to 3 winners to receive $1.5 million each, and up to 2 honorable mentions to each receive $250,000. Final decisions and selection of awardees will be made by Elevance Health Foundation, and then winners and honorable mentions will be announced in the fall of this year.
Next question. Will applicants receive feedback on their submissions?
Yes, so each peer-to-peer reviewer and evaluation panel judge provide scores and comments on the submissions that are assigned to them using the scoring rubric. A selection of those top scoring applications move forward to the evaluation panel and will receive an additional set of scores and comments from those judges. So not only will you receive scores on your submission from the reviewers, but you'll also get feedback. In addition to numeric scores, reviewers are required to provide comments to justify each score and note their overall impression of each application. We find that this feedback is one of the most important aspects of participating in challenges like the Patient Safety Prize. That even if you're not selected as an awardee, you walk away with valuable feedback that you can then use to refine your proposal and seek other funding or expanded support.
How can we use the Patient Safety Prize award?
Award funds must be used for the proposed project that you are intending to apply and may be dispersed to partners for project-related purposes. So funds can be used for the expansion, enhancement, and/or scaling of the project during the 2-year project period. Again, review the rules for more information about prohibited use of award funds.
What are the next steps if I'm selected as a winner or an honorable mention?
The winners and honorable mentions will be publicly announced in fall of 2026. Elevance Health Foundation will work with the awardees to execute an award agreement. We have provided a sample award agreement on the challenge website. And following the execution of the award agreement, the project will be implemented over a 2-year project period. Awardees will be required to report progress toward milestones and other goals. And then those reporting requirements may vary depending on the organization and the project and will be determined by Elevance Health Foundation. I encourage you to review the rules for more information.
Next question. Will one grant be awarded under each of the three broad themes, health literacy, medication eras, fall-free futures?
Based on the results of peer-to-peer review and the evaluation panel, as well as other factors that may include but are not limited to a wide range of solutions and geographies, the selection committee will recommend up to 3 winners to receive $1.5 million each, and up to 2 honorable mentions to each receive $250,000. It is not a requirement that one winner falls under each of the solution categories. Final decisions and selection of awardees will be made by Elevance Health Foundation.
We are interested in learning if the aim of this award is to fund a university-based study or if you're looking for the project to directly impact individuals. For example, a method for disseminating a falls solution to as many people as possible.
We're looking to discover proven, community-informed solutions that improve patient safety. So eligible proposals should be able to demonstrate a proof of concept, evidence of scaling, or current operations at scale. Projects in the research or ideation phases are not eligible to apply. Again, be sure to review the submission requirements for more information about the eligible stages, as well as the scoring rubric to understand how applications will be evaluated.
Next question. If selected as an awardee, what is the anticipated project start date?
Awards are expected to be announced in the fall of 2026, and projects are anticipated to begin shortly after, in approximately October to December of 2026. If a later start date is required, a request can be submitted for review by the Elevance Health Foundation team. And the foundation team will work with the awardees to execute the award agreement, which may vary depending on the nature of the project, the organization receiving the award, and the Elevance Health Foundation. Again, you can view a sample agreement from rules on the website.
Can you clarify what constitutes a lead organization?
Each applicant must identify a lead organization who will assume responsibility for the receipt and management of any award and will maintain those fiduciary duties in close coordination with any partner organizations. And the purpose of including a lead organization is really to ensure that there is sufficient administrative support and management for the use of any award funds. And it's not to disintermediate the role of any partners who are essential to the project's implementation. Again, please review the FAQ labeled eligibility and the rules webpage for the complete information about eligibility requirements for lead organizations.
Next question. May a faculty member complete the registration process by themselves, or would it be more appropriate for the Office of Sponsored Programs to handle the registration on their behalf?
So note that individuals are not eligible to apply as a lead organization. I encourage you to review the rules for more information about eligible and ineligible entities. And then please consult with your organization's leadership to confirm your eligibility and preferences with proceeding to register and submit an application.
Please offer examples of the types of innovations that might be of interest. Also, are applicants able to use some of the funding for development or customization of technology tools to support the proposed initiative in a proposal?
So this is Elevance Health Foundation's inaugural Patient Safety Prize. So we're unable to share examples of proposals for each solution category. Strong proposals for the Patient Safety Prize will focus on one or more of those categories and will include community-informed solutions with demonstrated impact, have a focus on vulnerable populations, and will meet the 4 criteria outlined in the scoring rubric. We encourage you to review the rules to learn more about prohibited use of award funds.
Will the webinar recording be shared or be available for review on the portal?
I think we have Amare.
Apologies, I was on mute. Yes,
Yeah,
the recording will be shared on the news page on the website. It will be posted on forums when you log onto the application platform, and it will be emailed to registrants of the Patient Safety Prize.
If the proposed idea does not itself have a track record, but the project has been implemented in a part of another successful project by investigators with a strong track record, will that still be competitive?
Strong proposals should emphasize positive outcomes for vulnerable populations. Eligible proposals should be able to demonstrate proof of concept, evidence of scaling, or current operations at scale. Projects in the research or ideation phase are not eligible to apply. Be sure to review the submission requirements for more information about the eligible stages and the scoring rubric to understand how applications will be evaluated.
Regarding promoting fall risk futures, is a community-based focus rather than a clinical or hospital setting eligible for consideration?
Yes, we are seeking community-based solutions that extend beyond a clinical setting.
Does the video pitch need to be submitted with the application, or is that only for finalists?
Yes, the video pitch needs to be submitted with the application. Finalists will also be asked to create another pitch video and share an optional project update for consideration by the selection committee.
What are the minimum and maximum award amounts?
The total prize pool is $5 million. 3 finalists will receive $1.5 million, a $1.5 million prize each, and there will be 2 honorable mentions that receive $250,000 each.
Can you please clarify if medication errors is at the patient level or the clinical level? Also, if our proposal focuses on medication adherence only, not medication errors, would that be okay?
We are accepting applications relevant to reducing medication errors at both the patient and clinical level.
Can we add letters of support from organizations we have worked with in other grants or contracts as a show of support?
While there are no specific questions within the application that request letters of support, applicants can add any additional relevant information that they feel will further clarify or support their application in the other considerations portion of the application.
Is a budget match required or encouraged as part of the application?
The detailed budget on the application must equal $1.5 million.
For the budget, should the $1.5 million be considered the total cost or the direct cost before F&A?
The budget must account for the full $1.5 million award. We will consider paying for these indirect costs up to a maximum of 50 costs or activity costs. Ensure that any indirect costs are accounted for in your budget.
Next question. What outcomes other than REACH should be included? For example, evidence of improved health outcomes, qualitative findings?
Applicants are encouraged to include all available outcomes and evidence of impact in their application. Proposals should demonstrate improved outcomes as it relates to the focus area you selected. Strong proposals will be able to demonstrate powerful, evidence-based solutions that can be a model for a range of communities, deliver impressive, deep, and wide community-informed results, especially in vulnerable communities.
What are you looking for included in the partner agreement? Does it have to be an MOU?
The EHF will work with awardees to execute the award agreement, which may vary depending on the nature of the project, the organization receiving the award, and the Elevance Health Foundation. You can view a sample agreement in the rules section of the website.
Word limits for each of the sections. Do you have a preference as to whether these are narrative versus bulleted?
No, there's no preference.
Approximately how many applications do you anticipate being submitted?
We are unable to share this information at this time.
For this question, do you mean the foundation or as a health insurance payer? In the past 5 years, has the lead organization received any funding from Elevance Health or its affiliated companies, Anthem Blue Cross, and Blue Shield, AmeriGroup, Carelon, Simply Healthcare, Unicare, and WellPoint?
This refers to both foundation funding and corporate community investments from Elevance Health and its affiliated health plans.
I understand that personal guidance cannot be offered, but is there a way to determine whether or not our proposed project would even be accepted based on the guidelines? We'd like to assess whether or not our project would even be competitive. Yes.
We encourage you to complete the participant readiness tool on the challenge website to assess your eligibility and fit for the challenge.
Next question. Can you describe how detailed the budget needs to be? It was hard to tell on the website.
We encourage you to review sections 6 and 7 of the rules for information regarding indirect costs and prohibited use of award funds. While we are unable to provide a template for the budget, you can review the required format under Detailed Budget on the application page.
General question. For the Promoting Fall-Free Futures category, does this refer to ambulatory falls or falls in a hospital setting or both?
Yes, so it's referring to both.
Can an alternative individual be assigned to complete peer-to-peer review if the main applicant is out of the country or on vacation based on potential review turnarounds? Can an alternative person from the team access and submit portions of the application in the dashboard portal, or can only one person submit everything for the team? How many people can be added as main contacts? I saw that only 2 names can be used.
Apologies, I lost my place. If you can take this one, Amy.
Sure. Yes, the team could work collaboratively on peer-to-peer review, or one person could complete this review. They will need to have access to the account that was used to submit the lead organization's proposal. Only one account can be used for each lead organization on the platform. Next question. Are projects that involve some software/platform application customization or development eligible?
Yes, eligible.
Do we have a community partner, or can we apply as a single organization?
Partnerships are not required.
Is the PSP intended to be an annual competition?
The Patient Safety Prize is the inaugural focus of the Elevance Health Foundation's Community Action Leadership Initiative. While CAL is an ongoing initiative, future years' topics have not yet been determined.
When creating the initial proposal or submission, should the team submit 2 proposals, one using a $250,000 budget and the other using a $1.5 million budget?
The budget in the application must equal $1.5 million. Please review the contingency question in the application, where you can detail how your proposal would shift if awarded $250,000.
One moment. Next question. How many applications do you typically receive?
Again, this is an Elevance Health Foundation's inaugural Patient Safety Prize, so we are unable to share this number.
Are indirect costs allowable? Up to what rate?
We will consider paying for indirect costs up to a maximum of 15% of direct project or activity costs. Ensure that any indirect costs are accounted for in your table as part of the $1.5 million budget.
Are there priority populations that Elevance emphasizes for proposal?
We focus on socially vulnerable populations, which may be defined by the specific community being served.
Next question. Can you define what ideation phase means in the patient safety prize context?
Sure. Eligible proposals should be able to demonstrate proof of concept, evidence of scaling, or current operations at scale. Projects in the research or ideation phase are not eligible to apply. For more information about the eligible stages and the scoring rubric, to understand how applications will be evaluated.
Should we show partnership with community-based organizations in order to apply?
Partnerships are encouraged but not required.
Can you please elaborate on MOU? Is it required after award is received or at the time of the application?
MOUs will not be collected in the application at this time. MOUs may be requested from teams that are selected as finalists.
One moment, we have a few more questions coming in. Do projects that focus on improving medication adherence qualify?
Yes.
One moment.
And while we wait for a few more questions to come through, I believe one of the responses was cut off in terms of eligible project stage. To review more information about the eligible stages, please do review the application page on the website. We have another minute or two. If anyone has more questions, please add them to the questions feature. As a reminder, if any questions do come up after today's call, please email us at questions@patientsafetyprize.org. And as a reminder, we are planning to hold another webinar for registrants. So please save that date. It will be on Tuesday, March 24th at 1 p.m. Eastern Time, and that'll be a good opportunity to dive deeper into the application. And as a reminder, the registration deadline is coming up on Tuesday, March 17th, 2026 at 5 p.m. Eastern Time. So if you haven't registered already, we encourage you to do so.
One moment, we have a few more questions coming in. Next question. Once award is announced, what deliverables are required following dispersal of funds?
This will be included in the award agreement, which will be finalized after finalists are selected in collaboration with the Elevance Health Foundation.
And as we answer one more question here at the end, just a quick reminder that this webinar is being recorded and we will email the recording out to registrants as well as post the recording on the news and updates page on the website. So please check back there if you'd like to reference this video later on.
When is the pitch video due, and is it in its original submission, or do we only submit if our project advances? And can you refine it later?
A short video is required as part of the online application, and a pitch video will be required for finalists who move on to the selection committee.
Next question. If proposed project falls in more than one area, health literacy, medication adherence, is there any recommendation on which one should be selected?
We recommend you apply within the category for which your intended outcomes most closely align. You may note within your proposal any secondary metrics or outcomes that support the other focus areas.
Does the project have to have a local, regional, or national impact and sustainability?
All levels of impact are eligible to apply.
One moment, a few more coming in.
Okay, in order to respect everyone's time today and stick within our time slot, I think that will be our last question. Um, and thank you all for your thoughtful questions today. We appreciate you being here. If you haven't done so already, please register no later than 5 p.m. Eastern Time on Tuesday, March 17th, 2026. Even if you haven't yet decided if you'll apply, this way you're registered and you'll have the opportunity should you decide to later on. And again, a recording of this webinar will be posted on the news and updates page, as well as to forums for those who are logged into the platform, and it will be emailed to all registrants. Please save the date again for our second Q&A webinar on Tuesday, March 24th at 1 p.m. Eastern Time. That will be a great opportunity to ask more questions as you dive deeper into the application. And if you have more questions after today's webinar, please do email us at questions@patientsafetyprize.org and we will respond directly. And thanks again so much for joining us. We look forward to your participation in the Patient Safety Prize. And now I'll hand things over to Dr. Agrawal for closing remarks.
Actually, you know what? This is Lance Christman, the president of the Elevance Health Foundation. So I'm going to jump in here and just thank everyone for their interest in the inaugural CAL Patient Safety Prize event. This has been 2 years in the making, and really want to thank the Elevance Health Foundation team, specifically Lamisa Sain and the Carrot team for taking it to this point. And also, as mentioned before, want to reiterate the importance of this to Elevance Health and how we're really attempting to inspire and accelerate community-driven solutions that make our communities safer. Encourage you to, as mentioned, register by the March 17th deadline. And also, please share this with your networks. We want the more the merrier. We want folks aware of this because we really do want to make a difference. So thanks so much for your interest and good luck.